And now we turn you over to Danita Cohen.
Hi everyone, I'm Danita Cohen, the Chief Experience Officer at UMC, and these are certainly unprecedented historic times that we are living in the depths of dealing with COVID-19, and we thought it would be helpful to bring our medical experts together so you can ask questions and we can try to figure this all out as a community together. So I am joined by two fantastic experts. We are so lucky to have them at UMC. Dr. Shabata Assad is our Medical Director of Infectious Disease, and Dr. Louis Medina is one of our infectious disease physicians. Thank you both for being here. So proud of you as my colleagues. Thank you, thank you. We appreciate your expertise. We have a lot of questions coming in. And by the way, if you want to submit a question, you can do so on the WebEx app. Just use the raise your hand function, and we will also try to answer any of those questions that you type in under the Q&A session. So we should start with, how does COVID-19 spread? And people should probably know that by now, but if they don't, how is this spreading so quickly?
So primarily it spreads by droplets. So those are small bubbles of saliva that come out of our mouths when we're speaking or when we're coughing or when we take a really deep breath and then exhale forcefully. And the virus is contained in these small droplets of saliva. They are, for a brief moment, suspended in the air, and if they fall on your mouth or your eyes, there's a potential that you become infected that way. This is why it's so important to cover your mouth when you cough or sneeze, and now there's guidance that suggests that everybody should cover their face in public, and that's CDC guidance. So the most common way of transmission is through these droplets of saliva that contain the virus in there. There's also the potential of those droplets then coming down to the floor by gravity or to a surface. And if you touch that surface, you pick up the virus in your hands, and then if you then touch your mouth or your nose or your eyes, the potential for that virus entering your body is there, and that's another possible way of becoming infected.
So it's everywhere right now then?
That's
on every surface. And is that how we should be thinking about it, that it is on every surface, every door handle, everything that we're touching?
So I think that's the safest thing to do, to just assume it's everywhere. It's very difficult to scientifically say what are the chances of you getting infected from touching a doorknob and in your face, because there's really no studies to prove that. But there is the theoretical chance that you could get it that way. Again, the most common way is in direct contact with other people that have the virus and then becoming infected that way. But if thinking about the virus being everywhere helps you remember and be conscious about washing your hands and not touching your face, and that's a healthy thing to do. Just to think about it.
Do we have any idea how long the virus lives on surfaces? Like if somebody sneezes onto a doorknob, how long is that sneeze sitting on the doorknob?
So when this all started, we were clueless about that, right? But now we do know a little bit more about this. So some of these viral particles, depending on the kind of material we're talking about, can remain alive for a while. So on materials like stainless steel and plastic, the virus can remain alive for about 72 hours. So that's about 3 days. On things like copper, it remains alive for just about 4 hours. So it depends upon the kind of material the virus lands on, but a good guess is that it can remain alive for several days on the common objects that are lying around.
So what are the symptoms of coronavirus, and how does that differ from the flu or a cold? How do we know that those are the symptoms of coronavirus?
And this is a tricky one, right? You'll hear experts saying that, well, this is what flu looks like and this is what the coronavirus infection looks like. But the reality of it is that even for experts sitting in an emergency room, sometimes that can be very challenging. I will tell you one thing, that in hospitals, something that we find a little bit less challenging now is the fact that we are coming towards the tail end of the flu season, which means that we're seeing much, much less influenza in the community. This is true not only for Las Vegas, but for the rest of the country as well. So somebody presenting to our ER with some respiratory symptoms, which I'll mention in a moment, is more likely to now have COVID-19 than influenza. But the main symptoms that we're looking for when somebody is presenting with a possible COVID infection is fever, that's the most common one, followed by sore throat, a cough, usually this is a dry cough, there's no phlegm with this, and shortness of breath. Those are the main symptoms. With influenza, fever again is a very big one, and muscle aches. Those tend to be the predominant symptoms with influenza. With COVID, it's a fever, shortness of breath, sore throat, and a non-productive cough. But honestly, even if you were to ask a physician, on paper, it seems quite simple. The reality of it is it's sometimes not easy to distinguish between the two. Like I said, we're seeing much less influenza now than COVID-19. It's just the way flu is. It runs from October till about April, and then it begins to tail off.
So when should people stay home and try to ride it out and think, I'll be okay, I just need to isolate? And when is it time to come in to be seen?
The thing about COVID-19 is it starts insidiously with relatively minor symptoms, the ones we talked about, a low-grade fever, just feeling tired, cough. But in some cases, particularly in elderly patients, patients who have underlying medical problems like diabetes, heart disease, lung disease, it does slowly tend to take a turn for the worse. So I would say that if in a few days you notice that the fever is getting worse, and perhaps even more ominously, you'd notice that your breathing is becoming difficult, those are very concerning symptoms, and sooner rather than later you should call your healthcare provider and see if he or she suggests that you seek further medical care. Another group of patients that I would suggest should be more vigilant about these symptoms would be elderly patients, patients who have underlying heart or lung disease, or those who have diabetes. These are conditions that we know that when these patients develop COVID-19, it tends to take a turn for the worse. So in my opinion, an ongoing high-grade fever and particularly trouble in breathing, these should be symptoms that you should really watch out for. If you feel these are getting worse, call your healthcare provider and they will then provide you with direction as to what you should do next.
So what types of patients are you seeing? Because at first we thought it was just going to be the elderly population would be the hardest hit, but that's not seemingly so, right?
So in the beginning of the epidemic, there was just a complete lack of data, and all the information we had was from the Chinese outbreak. And those patients seemed to be mostly elderly, and like Dr. Assad said, with high blood pressure or diabetes. We found that in the United States, it really isn't just a disease of the elderly. It has affected all the age groups to different extents. The health department has a very nice graph about the demographics or what kind of people have become infected in Nevada. And there's been even infections in children and some pediatric deaths. So we've noticed here also that people with obesity are at higher risk, and they have a harder time when they come onto the ventilator because the larger size makes it harder for them to ventilate. But it's been a disease that has hit every age bracket and equally among races. So there's not one particular group of people that is excessively at risk. So everybody should take
opportunity.
That's right. It does not discriminate, and we've seen that across news reports across the world. Boris Johnson, the Prime Minister of England, became ill, and he was in the ICU last week, and thankfully he made it through. So it's not a disease of the poor or the rich or the middle class. It literally affects everyone.
I think we have some questions from viewers coming in.
We have about 6 people with questions. The next question comes from Cynthia G. She's asking the experts here, can the virus travel through air ducts, as in like apartment buildings?
So most apartment buildings have their own dedicated HVAC system. So it's a closed circuit for that apartment. So if one person, in a closed space has the virus and is very sick, is there the potential for them contaminating others through that same duct system? It's possible. It's not easy to find out how likely that is. So one thing is for something to be possible, and then the other thing is for it to be likely. So when somebody is isolated at home, the CDC recommends for that person, the sick person, to wear a face covering or a mask. And the idea behind that is if you cough or if you speak and you have these, droplets of saliva with the virus in there, if you have a face covering, they'll get caught in the face covering, and that would help people lower the chances of getting infected. So even though it is possible that you could, have that virus travel through the air ducts, it's probably unlikely that somebody would become infected that way.
So I'm just going to use this gentleman's initials. JC is asking, he has the need for an angioplasty, and he was supposed to have had it on April 3rd. He's asking now, does he wait till the virus is over to press his doctor to get this procedure done, or do it now?
So I would say, JC, it depends upon the reason why the angioplasty was being done. If this was being done for a purely elective reason, which means that, for a couple of months he was walking around, he noticed he was getting chest pain when he exerted himself, and this is something that can be deferred for a couple of weeks safely in consultation with his cardiologist, then I would recommend postponing it right now, which is exactly what the recommendation is, that if there is a procedure which is elective, then postpone it for now. The rationale for that is that it prevents patients from being exposed to other patients in hospitals who might have infection, but it also preserves a lot of resources for hospitals that are needed for healthcare providers that actually needed to take care of COVID patients. But on the other hand, if this is an acute emergency, so the angioplasty is required because he has severe chest pain, then it doesn't matter. Then it needs to be done now regardless of the COVID situation, and the hospital and his cardiology team will take all the appropriate precautions while doing the procedure. So it all depends upon why the procedure has been recommended.
Okay, we have another question from Kathy K. She says, or she's asking, after several months of isolation, do you think we'll still be able to, or will there still be a risk of contracting COVID-19? And what is the progress towards a vaccination? Do you think the virus can truly be eradicated?
So several different questions here, right? Okay, let me pick up the easy one. What is the progress towards a vaccination? I think Dr. Anthony Fauci has addressed this in several different interviews. To prepare a vaccine is a long process. It requires several months to just get into the process where it enters into efficacy trials and safety trials. Realistically speaking, it's not going to be at least a year till we have a vaccine out there to be available. So that's one. Do you mind repeating the second part of that question?
Her first question was kind of a hypothetical, which was basically after the isolation of us staying home to stay safe for Nevada. After that has been, we were allowed to then go back out. She's asking, I guess, what would the risk still be of contracting the virus?
One of the hopes is that as time goes on, right, a fair number of people will have been exposed to this virus, and there will be a fair number of population that actually, as part of the natural process of getting infected, will actually have developed immunity to this virus, at least for this particular year. Of course, there will still be many people who will never have caught the infection, and yes, they will still have the risk of contracting the infection. And the hope is that somewhere along the line that vaccine will become available and those people can then be vaccinated. Now, this question of how many people will still not be immune to the virus and could still contract it, that might be easier to answer when we have that specific test that actually looks at who is still susceptible to infection and who has good immunity. So that test will also help answering that question. Now, is this one of those viruses that is just a once-a-year thing or will ever come back again and again and again like the flu? That is something we absolutely don't know. The previous two coronaviruses that the world dealt with, the MERS virus, happened once in 2012, has never come back since. The SARS virus that came in 2003 never came back again. Do we know if this virus will come back in a cyclical manner year after this? We honestly have no idea at this point.
Well, what I would say to that is the risk does not go away completely. And if you look at other communicable diseases like measles or chickenpox, that for which there are vaccines, the vaccines aren't 100% protective. but they protect enough to avoid them from spreading rapidly. And that's probably the key point. And like Dr. Assad said, we don't know if this is going to become a seasonal disease. The only thing that I worry about as compared to the SARS or MERS coronavirus is that this spread much quicker.
Yeah, exactly.
So that it got all over the world in a matter of weeks. So a vaccine will certainly be a very helpful tool. And the context of vaccine development is that never in the history of medicine has a vaccine candidate become available for testing in humans so quick. So this took about 2.5 months to get to this trial in humans, which is unprecedented.
Right.
And a lot of that is because it was built on the vaccine work for the SARS and MERS coronaviruses 10, 20 years ago. So testing in humans, both for safety and efficacy, is really important. Everybody wants a cure. We all want a magic bullet. But it cannot be at the expense of safety of the masses. You have to know that what you are doing for people is not dangerous, because then it becomes irresponsible. We want to give somebody something because we want them to do well. But if we have not vetted it, if we haven't seen this through to the usual mechanisms of science, it's a really dangerous thing to do.
And Danita, if I might make a pitch for one thing over here, there are naysayers out there against vaccines for measles. And so for all those people out there against vaccines, I have only one thing to say: this is what a world without one vaccine looks like. So just something to think about.
And you know exactly what this is doing to patients
Exactly.
who are critically ill. So as you say, I know where you're going with this. Think about that when you decide to get your children vaccinated or
This
not.
is what a world without one vaccine looks like.
We have a couple questions for what should we be doing at home. So how far should we be taking this? When we go to the grocery store, are we supposed to be bringing everything, before we bring it inside, are we supposed to Lysol it all off? Or how far do we go with this?
So I'd say, first of all, if you don't need to go to the grocery store, don't go. There are so many things that you can do without. And in America, we have everything at our fingertips. And if it's not by going in there and buying it, you just push a button on Amazon and it gets to your house. But I think making a conscious effort of what you really need and making a list and planning it out for an average of 2 weeks, I would say, is a good start. So if you don't need to go, don't go. When you do go, and if you can, have one person to be the designated person to go to the grocery store. And then when you're there, be conscious of everything you touch and everybody that you're around. For example, if you go to a big box, grocery store where you buy in bulk, there used to be a lot of, people at the same place. So if you're running down your list and you have milk and eggs and toilet paper, if you're lucky enough to find it, and there's a whole bunch of people in that section, well, go hit the rest of your list first and then come back to that. So to avoid those crowds of people. And then when you get home, well, actually, when you get to the car, sanitize your hands if you can. And then when you get home, try to be as careful with bringing those things in the house. People ask, should I be sanitizing my groceries? And there's no data that says that that's going to protect you as opposed to not sanitizing your groceries. But if it's reasonable and it gives you peace of mind and you have an extra couple of Clorox wipes, there's nothing wrong with wiping down the items you just bought before you bring them into the house or putting them into the fridge. I wouldn't recommend that you put Clorox on your vegetables, but when you get close to cooking them, just wash them as you would normally do, and take precautions that are reasonable.
It really does make you rethink everything. Like when you pick up a can of something, do either one of you ever think, did somebody else touch this and put it back already?
I can't help but think.
I know.
That somebody else already touched
I'll
it.
tell you, I get a lot of questions like this. Does touching this cause the virus? And the way I try to think of it, because there are many things that I never thought about, if you can clearly understand how the virus spreads, you can intuitively understand what is important and what is not important. Just remember, the most important way of transmission, like Dr. Medina Garcia explained, is the cough and the sneeze, which contains these heavy particles that only travel, for the most part, 6 feet. right? That's the main mode of transmission. And the other one is those particles landing on stuff, which can be pretty much anything, you touching those things. Now remember, your hand with the virus doesn't transmit disease. Solid surfaces with the virus on it doesn't transmit the disease. It's when you take those virus from those surfaces and rub your eyes, nose, and mouth, that's how the virus enters your body. So even if your groceries, the bags or whatnot, have virus on them, and you touch those, that's not going to give you the infection. It's when you touch them and rub your eyes, nose, and mouth, that's how you get the infection. So avoid touching your eyes, nose, and mouth, and stay 6 feet away from people so that you don't get those cough and sneezing particles. And cover your own nose and mouth when you're sneezing and coughing. So remember how this virus spreads, and then you kind of figure out what is important and what is not important. Keeping a hand sanitizer in your pocket, in your purse with you is a really good thing to do. Remember to not rub your eyes, nose, and mouth, and keep that 6 feet distance from people. Those are the 3 key things. Focus on these 3 things and don't stress too much about the minor stuff.
It's our faces.
And that's so difficult because hand hygiene by far is the most effective intervention. But it's so difficult not to touch your face. Exactly. And you don't think about it, but you know, you pose, you scratch your nose, you rub your eyes, and
stop posing.
And
and
it's just human nature. So making a conscious effort to wash your hands as often as you can and don't touch your face, I think that's the most daunting but the best advice.
We do. We still have some questions, and we're going to try to get to them all. The next question comes from Pamela S. She has a specific question about, she says, some people do not have spleens, which she believes puts them at higher risks, especially when it comes to developing high fevers. Is there any information that you can give Pamela S. regarding people who don't have spleens, and what would be your advice to those people?
So people without spleens, for whatever reason, do have a higher chance of developing infections. For the most part, we worry about bacterial infections with a certain set of bacteria, which we call the encapsulated organisms, but that's too much science for this conversation. I think that the same precautions apply across the board. Could they have a higher chance of acquiring COVID? Potentially. But there's no good scientific way to measure that. So I would say to her, take all the precautions that are recommended for everyone else. And if you could be more cautious, that's great.
We have another question from Stacy. Stacy's asking, is it safer to run evaporative coolers or swamp coolers? Because temperatures are going to go up here. And I think this goes back to, can the virus transmit through a swamp cooler or an evaporative cooler system?
So, I mean, I don't think it makes a difference because the water droplets that are from swamp coolers are not going to have the virus in it. So I don't think it poses additional risk.
Judy D is asking, she says she has a trip scheduled to another state, and that state has more hotspots. Should she proceed with that trip?
I would say common sense advice is to not go if you don't absolutely need to. And it's very difficult because we planned our lives for a life without COVID. But we have to think of the context of things. People are dying alone. People are not having the ability to have viewings for their loved ones before, you know, they're either cremated or buried. So if your trip is worth the risk, that's only a decision that you can take. But just from a common sense standpoint, I would say if you don't need to go, don't go.
We have a question from Laughlin, actually. It says, I'm concerned that any COVID-19 virus cases are in our township. They're not being reported, as the Southern Nevada Health District reports, only by county and not by zip code. And they're wanting to know, how could they know if there are any cases in Laughlin?
So I'm pretty sure the reporting mandates are statewide. The issue would be, how do they know it's a COVID-related problem if they don't have available testing? And for the most part, labs self-report to the state, but I'm not quite sure how it works at the rural aspect of things.
I'm pretty sure that if they contacted the Southern Nevada Health District, they'd be able to tell them if there were cases reported from Laughlin.
And I think just today I saw where you can go to the health district site and put in the zip code.
Exactly.
And it will say what cases are in your area. Okay. We have a question from a pregnant mom who wants to know if she could possibly pass the virus on to her child.
And this is a question that a lot of pregnant patients are asking at this time. To date, there is no evidence that there is any transmission of the virus from the mother in utero to the baby. They have looked at amniotic fluid and they've looked at breast milk. There is no evidence of virus in that. Having said that, remember, the world did not know about this virus until 4 months ago. So 6 months from now, will this information change? It's possible, but to date, based on published data, there is no evidence of transmission from the pregnant mother to the unborn child. Now, there have been case reports of babies born to mothers who within days of birth have acquired COVID-19, but that was because of close contact with a mother who had the infection. So,
Victor, any other questions?
Yes, we do have another question. This one comes from Facebook. What do you think about tourism coming back to Vegas? Will people feel safe in casinos, etc.?
I'm sure it will come back. You know, time heals everything, but we need time.
And this is why it's so important to continue the efforts, right? If you can prove to the international community that coming to Las Vegas is safe, then the industry that is the largest industry in the state will come back to life. So that's why everybody's efforts are really important to continue the suppression of this disease. And then once we have more ability to test and hopefully at some point either a vaccine or a treatment that's specific for this, it'll help us get back to where we need to be so that everybody can go back to enjoying Las Vegas.
You know, history has proven that even the worst pandemics are no match for human resilience. And I don't believe that this pandemic is any different. The people of Nevada have clearly shown that they can follow guidance and recommendations, and they've done an amazing job. We are at our peak and it doesn't feel like a peak, and I'm keeping my fingers crossed. We're still on our toes. We're being prepared for the worst, but we've done great so far. And I'm hoping that we're going to keep working on this and we're going to flatten this curve. And before you know it, we will be back to the happy, lively city we were.
Thank you both so much for spending time with us. I'm so proud that you belong to UMC and that we have your expertise. And probably when you went to medical school, you had no idea this would be on the horizon. None of us did. But I'm so thankful that you're both here and that you both join us every day at UMC.
Thank you.
So we'll do another one of these town halls in the coming future here on Clark County Television. Again, thank you both very, very much.
You're welcome.
Thank you to the viewers that are watching. We didn't get to all of your questions, but as Danita just said, we will do more of these in the future and we will get to them.